Have you found yourself in the ER or urgent care because all of a sudden you were having heart palpitations, or you were really short of breath, you were lightheaded? It could be a combination of all of these, and you were pretty sure you were going to die, or you were having a heart attack, and it's awful. It's an awful experience. And if you've had that experience, I feel for you, because I know how terrifying it can be. A new patient I spoke to yesterday he lives in a big city. He was on the bus. He rides the bus all the time, and was just on the bus, and all of a sudden his heart started racing, and then he was short of breath, and then of course he panicked, and off to the ER we went. So, but then what happened? When you got to the ER, what happened? And I think that was a good destination for you, especially if you've never had this before. We want to rule out the number one killer of Americans is heart disease. So you want to rule that out. But again, what happened when you went to the ER, or you went to the emergency room? You went to urgent care. What occurred? Of course, they checked your heart. And if you're a person that has hiatal hernia syndrome, you probably heard something like this. Well, you didn't have a heart attack. Your heart is fine. We checked your oxygen level. That's fine. You don't seem to have asthma. Your heart rate was elevated because you were sort of in a panic mode. That's settled down. You mentioned, you have acid reflux. Want to make sure you're taking your antacid. And then if the anxiety is continuing, or the blood pressure is elevated and it's not coming down, they'll likely give you a blood pressure medication, perhaps an anti-anxiety medication, and you're sent on your way. So the visit goes something like that. But you're sent home. Maybe you should go see a gastroenterologist if you don't have one, you haven't already seen one, etc. So where does it leave you? If you've been suffering with acid reflux, you already know. You've probably been medicating it somehow, or just putting up with it. You're glad to know you didn't have a heart attack, and you're glad to know your lungs are fine. But now what? When is this going to happen again? You get anxious just thinking about when it's going to happen again, because it came out of the blue, and you were lightheaded. Maybe you sort of felt tingly in your arms or even your feet. You had trouble breathing. It is a terrifying event. And now you don't really have an answer. It's not like you were told, this happened because of this, do this, right? You didn't get that information. So hiatal hernia syndrome, what's called a syndrome, because it is a coming together of a lot of different facets that lead to this terrible experience. And as soon as the heart is ruled out as not being diseased, that feels good, right? That you didn't have a heart attack and you don't have heart disease. But why? Why was the heart, palpitating like that? Why was the rhythm off? Why did you just feel it pounding in your chest? It's a secondary phenomena, the same with shortness of breath. So ultimately, hiatal hernia syndrome is a digestive gut inflammatory condition. And it's really important to understand inflammation, because it's truly what's at the root of pretty much every disease we're trying to not get, every disease that's killing Americans, including heart disease and diabetes and dementia and autoimmune diseases and cancer. It's all an imbalance of inflammation. Now, getting back to hiatal hernia syndrome, that inflammation is typically happening in the colon, your large intestine, and it can also be in the small intestine, and it can also be in the stomach if you've been diagnosed with gastritis. But the root cause is this inflammation that's creating increased intra-abdominal pressure, it's called. So more pressure in your lower part of your abdomen. So it can give you gas and bloating and constipation. You can have gut pain. You can feel like you can't really eat very much, and you get full very fast. And then when you do eat, you can get the shortness of breath and the heart palpitations, or shortness of breath and heart palpitations can occur on their own. But the phenomena is we've got this inflammation and pressure, and then the stomach gets compressed, as it gets compressed, it has no choice but to bring its contents, which is acid, up into your esophagus. So now you have GERD or reflux disease, and you feel burning, you feel this discomfort, you feel very tight where your stomach meets your chest bone, your sternum, and you can have a lot of bloat, and you can get the shortness of breath because the diaphragm is right above the stomach. So as that stomach compresses, it gets pulled up, and now the diaphragm is sort of spasmed, and it can't move floating freely and effortlessly the way it should. The stomach and the heart are right in alignment. So as the stomach elevates and pushes up the diaphragm, now they're both getting in the way of the heart, and the heart doesn't like that, and it can go into these palpitations. So this is a known reflux, a gastro, meaning stomach, cardiac reflex, and it is this relationship that kind of primes the pump and gets it going. So we understand, we've been specializing in this for more than 2 decades, and we understand exactly how this phenomena occurs, plus what to do about it. Because you don't want to live on antacids. They have a lot of dangerous side effects. They're only approved for 2 weeks at a time by the Food and Drug Administration. And if you're sitting there raising your hand going, I've been on these for not just months and not just years, but decades, because I regularly meet patients who are in that category, yes, it's a problem. We need to get you off of those. Not to just stop them and make you miserable, but get to the root cause of why the stomach's being compressed. Realize the stomach's job is to be a bag of acid. That's how it breaks down your food. So it's not doing anything wrong. The wrong aspect is that pressure on the stomach that then brings the acid up. I should mention that some people have what's called silent reflux, and it's not just some, it's about 50-50. So you can have reflux of the acid that instead of gushing up where you get, this burning and you're tasting acid and it's all very dramatic and kind of disgusting, 50% of people have silent reflux. So the acid is just sort of trickling up the esophagus, and for those people, they feel symptoms more in their throat. They'll get a hoarseness, they'll get a pressure, they start having maybe trouble swallowing. So that's another kind of reflux, but it's still reflux. So this ER visit, or this urgent care visit, at its root, we have to figure out why we have inflammation. And the beauty of that is not only does it handle why you ended up having to go to the ER, but your overall health picture improves dramatically, because the source of inflammation creating hiatal hernia syndrome is likely creating other issues that either have been diagnosed or will be diagnosed soon that are also at their root have inflammation at its cause. So the exciting news is that we know what to do about this. It's natural treatment, it's drug-free, and it works very, very well. And I mean, this man yesterday I spoke to, had this happen on the bus. It all started last May. I'm doing this, it's December, it's just before the holidays. And his life has been just hell for 7 months. He had to quit work for 2 months. He couldn't go to work. And so if you're listening to this, if this is you, I understand, but it doesn't have to be you anymore. There is a solution, and I'm happy and would love to do that for you, because I know how miserable it can be, and you don't deserve to have your life be interrupted like this, right? You have your goals, you have your purposes, you have things you want to accomplish, and this shouldn't have to get in the way. So reach out to my staff. We're here for you, and I wish that for you, and I want you to feel great again.